98 of those patients are on ventilators. Health leaders issue a stark warning.
As Caitlin Rust reports, doctors say the Omicron variant may be more mild, but what's happening in hospitals is anything but.
I can't remember the last time a cold shut down the American healthcare system.
Advances in treatments combined with Omicron's seemingly less severe illness can obscure this surge's true cost.
A bed is a bed, and we don't have them right now.
With Omicron smashing case rate records, hospitals are still being flooded. Dr. Jennifer Avegno says in 3 weeks, hospitalizations have risen statewide faster than in the Delta surge.
If you go to an emergency department right now, expect to wait 6, 10, 12 hours to be seen just to get back to the emergency department. We are having staff outages in the triple digits. That's common at some of our larger facilities. Patients, in some cases, are lined up in the hallways. And I will tell you, for me personally, that's really difficult to see. This is something that used to happen when I trained at Charity Hospital. It was not appropriate then, and we knew it. It's not appropriate now.
Across the country, the healthcare system has taken a huge blow. The Bureau of Labor Statistics shows more than 500,000 workers have left since 2020, and now those who have stayed can't work because they too are catching COVID.
It's really not a physical space issue that we're seeing right now with COVID in our hospitals, but it's a, it's a workforce issue. It's having enough nurses and respiratory therapists and physicians and all the other people that it takes to run a hospital. They're available to care for the patients.
Dr. Jeffrey Elder with LCMC says as they get staff back from isolation, more just take their place. Although he says the numbers have been looking a bit better, there's still a lot of COVID in the community.
That's going to be the battle we're going to fight over the next couple of weeks. We hope that soon we will start to see a peak in the number of new cases, and we'll start to see that number come down. But we're still really high right now. We're seeing case numbers that we've never seen before.
North Oaks Hospital in Hammond is predicting a tremendous wave of patients over the next 2 weeks, larger than the previous surge.
That's concerning to me about our ability to be able to provide the care that North Oaks wants to be able to provide. Last week, I had over 100 employees of our almost 2,700 employees that were out.
Dr. Elder says still 80% of their patients are unvaccinated, also adding that half of their COVID cases are secondary diagnoses, meaning that wasn't what the patient came for, but he stresses that will still take extra manpower, PPE, and isolation. Shelley.